Hey, so it's September 19th, 2011, and I have obviously had top surgery. I already posted videos of the reveal and stuff at the hospital, but so my surgery was on September 9th, so now I'm 10 days post-op. I anticipate this being kind of a long video because I want to be kind of in-depth about my experience to be helpful for other people. Um, I will start just showing you this, I suppose. Dr. Medali, Cleveland, Ohio, Metro Health Center, very good job. It's still quite swollen. I can still feel the layers of sutures, and that's why it's so poofed out right here. It's actually quite hard. And I'm still a bit swollen here, and still a bit swollen here. But, as you can see, it looks great. Yeah, very, very happy with the results. Um, Nitpicky parts, it's a tiny bit asymmetrical. This is not as far out as this one. I don't give a shit. I think it looks fantastic, personally. My nipple grafts look pretty disgusting right now. I'm hoping they're okay. They seem to have gotten blood flow coming back to them, but they're actually just kind of bleeding just a tiny bit every time I wash them. So blood flow is good, bleeding makes me uneasy, and they look just disgusting, but I think they'll be okay. So, pre-surgery. When my partner and I got to the hospital, you basically just sign in, they try to make you pee in a cup, which I couldn't because I hadn't had anything to eat or drink for, uh, you know, a little over 12 hours, and I peed before we left for the hospital because I didn't realize they were going to need a urine sample, and I couldn't give them one, which wasn't a big deal, and obviously they still did the surgery anyway. But, yeah, just so you know, they're going to try to take a urine sample, and you're not going to have anything in you because you're not going to be drinking or eating before your surgery. So, sit and wait for a while, they call you in, you undress, get into your gown, put on your silly hat. This you do by yourself, and after they talk to you for a second, they allow your family or partner or whoever to come in and sit with you for a while you're waiting for the actual surgeon. I was sitting for quite a while. It seemed I was very, very nervous, and I really, really wanted to have something to calm me down. I was mostly nervous because I am terrified of surgery, and because I used to be an IV drug user, and my veins are really scarred, and I'm always nervous when people have to put an IV line in me because it's hard to find veins, and that makes me nervous. But the lady, the phlebotomist who got me, was a very grumpy, hilarious kind of lady, and she got it spot on, no problem. Didn't have to poke around. It was so good. Um, and they start you with a saline drip, and then they give you something to calm you down. After I actually met the entire surgical team and the entire anesthesiology team, which consisted of 2 people, but the surgery team was quite large, and they were all so nice and so wonderful. The anesthesiologist is amazing. She is smart as a whip, super nice, really calming. She was just great. And yeah, like I said, his whole surgical team and him are very nice people, extremely easy to talk to, very calming while you're so incredibly nervously sitting there waiting, and it's so bizarre for, I mean, it's a bizarre experience for anyone to be in a hospital, but I hate hospitals, and I, I just hate things like that, so it's very, very surreal. You're like, what is happening? Um, yeah, very, very strange and surreal experience. Then they give you something to calm you down, and you kind of say goodbye to your partner, and I remember being wheeled into the operating room and meeting the rest of the team, and it actually took 2 doses of whatever it is to put you to sleep, to put me to sleep, because I have a very high tolerance to things. So I was awake for quite a while in the OR, but I was very calm at that point. And the team was joking with me, and it was nice, and and all of a sudden you are not there anymore, and you wake up from surgery, and it's done. And I woke up from anesthesia really quickly because of my high tolerance, and I ended up sitting in the room for quite a long time before I got to see my partner, and that was really frightening because your post-anesthesia brain, which is also pumped full of morphine, has very little clue about what's going on around it, and you really want somebody familiar. It's scary, but they don't let you see anybody until you're awake enough so that they can sit you up. But for some reason, I was sitting up for quite a long time, and at first I didn't really feel anything except sort of just pain, mild throbbing. But the more I woke up, the more I felt a lot of pain and very, very nauseated. I have been under anesthesia more than once and never had this problem, but for whatever reason, this time the anesthesia made me extremely, extremely nauseated. So they gave me some incredibly high-powered anti-nausea stuff before they took the IV out, and that helped for a while. But after we left the hospital, for the next maybe 16 or 18 hours, I was just miserable. Just like so nauseated. I ended up throwing up, and it was very unpleasant. And we stayed in the Cleveland area in a hotel for the first 24 hours because they require you to stay at least 24 hours near the hospital, rather, because hematomas usually happen within the first 24 hours, and they want to make sure you're okay before they send you on your way. So that stay in the hospital was pretty unpleasant. The bed was very uncomfortable. I had a hard time propping myself up, and I was afraid that if I fell asleep, I was going to naturally try to turn onto my side, because I sleep on my side generally, and so I had a really hard time sleeping, and I was just so super nauseated. Luckily, when I threw up, my stomach was full of liquid, so it came out easily. I was just afraid that when you come out of something that intense, it feels, you have this feeling like it's just going to all fall apart. Like the stitches are going to come out, your chest is going to fall open. It's a terrible feeling, even with the post-surgery compression vest on. Terrible feeling. But it wasn't, it turned out not to be that bad. Then from there, I went back to Ann Arbor to recover in my hometown with my friends. My friend has a chaise lounge, which was perfect. It propped me up. I couldn't roll over, and that's what I slept on the entire time I was there, and it was really, really wonderful. And after the nausea went away, it was much more tolerable. I was in pretty significant pain. I definitely took the painkillers. I let them wear off a couple of times just to see how painful it was, because I'm curious like that and I wanted to know, and it was painful. Take your medicine. I'm a little bit older too. I'm not, I'm in my 30s, so I don't bounce back quite as fast as young bucks out there. So yeah. So then I was pretty much swollen and itchy, but numb at the same time. I had this bizarre feeling, this like, I felt like I could feel my nipples where they used to be, which obviously they aren't there anymore. It was like this bizarre phantom nipple feeling, but that went away after a couple of days. Also, the things that made life so much easier were Charles Asher's suggestions to bring straws and laxatives and button-up shirts. Thank you, because you definitely want to bring laxatives, because you're not going to be able to shit, and that is a terrible feeling. And both anesthesia and the opiate painkillers they put you on make you constipated, and it is very unpleasant. You bring the laxatives and take them. right after surgery, like as soon as you possibly can. And straws, because you are the T-Rex and you can only do this. There's none of this, only this. And you're like, meh. And obviously button-up shirts, because you're not going to be able to put anything over your head. In fact, like yesterday and the day before were the first days that I could actually wear a t-shirt. At the follow-up appointment, 5 days later, they take off the vest and show you the results for the first time. Dr. Medali puts a layer of adhesive foam on your chest under the compression vest, and that was extremely itchy the entire time I had it on. And so when they peeled it off, it was the most wonderful feeling ever. And Dr. Medali and his nurse practitioner actually took both of the drains out at the same time, which was great because it is a very bizarre sensation. So just getting it done in one go was awesome, and it wasn't that bad. I couldn't feel it coming out of my skin because I'm actually quite numb pretty much in this whole area here. It just felt like they were maybe tearing off a really stuck-on bandage. So that wasn't too bad, and then they send you on your way if everything is okay, which it was. So now I'm still swollen, like I said, a little bit here, and here, and here. Still sore. It feels like I just overworked my muscles. I feel like I worked out a lot in my pecs, and I'm assuming this is from the liposuction because of the spots that I'm the sorest are here and here. Where the lipo was, you can actually see I'm bruised back to here from the lipo. This is from my surgical vest that I have to wear. It digs into my armpits and it's quite uncomfortable. My skin is really sensitive. Lipo bruising all the way back to here. And this is that's actually the drain hole, which he tries to kind of hide in your pit line so that you can't see it, which is nice. The swelling is starting to go down significantly. It's still itchy. This area is itchy. It's healing, you know, and the healing flesh is itchy. So especially with the vest on, it's still quite itchy. The steri strips came off all the way on this side, except for this one spot right here. And it's still stuck on this side. I think it's mostly stuck to my chest hair. And also, they use all of the sutures are under the skin. I think there are 3 layers of sutures, and then they use a glue to glue the top layer of your skin together. And I think the glue in my chest hair are what the steri strip is stuck to, but it's slowly peeling away. You have to use bacitracin on the nipple grafts and the exposed incision areas and the drain holes for 10 days after your follow-up visit. And after it's healed enough, after the grafts have taken well, they suggest that you use Vaseline. You are not supposed to let the grafts dry out at all. So you have to keep them moist. I have bacitracin on them right now because I don't want them to dry out. But after they've healed enough, you use Vaseline, and they suggested just lotion for the scars, which I feel like if you use a really good lotion with, say, like a cocoa butter lotion, that really helps with scarring. I'm not concerned tremendously with scarring because I'm covered in scars and tattoos. So that's what I'm going to do, and yeah, that's pretty much it. Trying to keep this just under 15 minutes, which it is, so if anybody has any questions that I didn't answer, feel free to message me. All in all, I had a great experience. Painful, but so worth it, and I'm so happy with the results. So yeah, cheers.